Yeah, so one that I do remember, which is not that long ago, because my memory is not exactly first class, so recent ones are good, was a couple who came in and, we talked, and I always allow at least an hour for the first consult because with something like this, one doesn't know where the consultation will lead. One doesn't know in advance what the problem's going to be. Now, this was actually a couple who could not conceive, but yet they'd been to orthodox people, they'd been to nutritional people, and everything seemed to be fine. So, in other words, all the orthodox tests, nothing showed up as being a particular physiological problem. So, I then started talking about uh, early stuff, emotional stuff, stuff from their childhood. And the wife told me, and she was very distressed about this, that she had been sexually abused as a young girl. And what we came to was a sort of an understanding, and it may or may not have been exactly the full understanding, but there was something within her which sort of still carried a degree of shame and also a feeling of not being worthy of having children. And this, of course, the mind can rule the body. We know this in so many ways. And so what the main treatment was going back to that episode in her life and giving her the appropriate remedy to work on that. And within 6 months, she was pregnant. Now, this is a couple that have been trying for years and where there was no obvious physical problem. So that sort of example is not uncommon in my experience because, as I said, I don't necessarily specialise, as some homeopaths apparently do, in fertility, where they may use homeopathic potencies. So you see, homeopathy can be used in a range of different ways. In that example I just gave you, I used high potencies of infrequent doses, like once a fortnight. So you're not taking something all the time. And those high potencies can go right back to the person's childhood and their infancy if necessary. But you can also use homeopathics differently, like, for example, to change hormone levels. If, for example, there are problems with estrogen or progesterone levels or in the male testosterone levels, you can actually use high or low potencies of hormones to increase or decrease hormone levels. Or sometimes there are other remedies, a very well-known remedy, or two well-known remedies in homeopathy are sepia and pulsatilla. And many of your listeners who have used homeopathics have probably, those names are probably familiar, but they are constitutional remedies for other uses. In other words, they have their own personality profile. The pulsatilla type is needs love. They're very caring. They're very tactile people. They love hugs and cuddles, and usually as long as they feel secure in a relationship, they'll blossom. The sepia, on the other hand, when they're unwell, they want to be on their own. They even if they're upset, they don't want consolation. They can push their loved ones away. Low potency sepia is one of our best remedies for postnatal depression. In fact, I would say I've seen probably about an 80% success rate for patients who have seen me with postnatal depression over the decades. And that's all they need, a low potency of sepia. But we use, if we want to stimulate estrogen or progesterone, then we would use low potencies of those remedies or low potencies of the hormones themselves. If we want to reduce the levels, we would use high potencies of the hormones or maybe those other remedies. With the male, if we want to increase testosterone levels, we can use a low potency of testosterone, or we can look at the endocrine system and go back, and it may well be, and this is another thing that I've actually seen in a number of patients over the years, talking about a physical thing, that they were not able to conceive, but when we looked at the case, the woman in particular gave symptoms of underactive thyroid. Now, you know, the endocrine system or the glandular system is a negative feedback loop. The thyroid is regarded by many as the master gland. So if the thyroid's underactive, that can affect the female reproductive hormones, and also the male, by the way, as well, although it's much more common in females than males for whatever reason. And so in a couple of cases, by using homeopathic medicines, in particular, I use a low potency of TSH, thyroid stimulating hormone. So some people give low potencies the hormone itself. I actually prefer to go back one stage in the endocrine cycle and use low potencies of TSH, supported by something like bladderwrack or kelp, which is very rich in natural iodine. So you need to give the nutrition to the thyroid, which is through the herbal, and you need to stimulate the endocrine system to start the natural increase in the production of the thyroid hormone itself using the low potency TSH, and that then can stimulate the rest of the endocrine system, including the reproductive system. So, you know, it really is a case-by-case issue and trying to find out what really is the cause.